The Pan American Health Organization, or PAHO, announced a critical investment of $84.1 million to bolster pandemic preparedness in Latin America and the Caribbean. This funding, unveiled on October 23, 2024, aims to fortify the region's health systems against future health emergencies. The COVID-19 pandemic and the 2022 Mpox outbreak revealed critical gaps in global health infrastructure, particularly in resource-constrained regions. Latin America and the Caribbean faced significant challenges during these outbreaks, highlighting the urgent need for enhanced preparedness measures. By bolstering epidemiological surveillance, laboratory capacity, and emergency response mechanisms, the funding aims to mitigate the impact of potential outbreaks and protect the health and well-being of the region's population. Collaborative efforts, such as this initiative by PAHO, are essential to building a more resilient and prepared global health architecture. PAHO's $84.1 million investment will be strategically channeled into 5 key initiatives designed to bolster the region's defenses against infectious disease threats. The first initiative focuses on enhancing disease surveillance systems for early detection and rapid response. The second initiative centers on improving laboratory capacities, including infrastructure and training. The third initiative focuses on strengthening the health workforce by providing training and resources to healthcare workers. The fourth initiative aims to improve early warning systems for real-time detection and tracking of health threats. Finally, the fifth initiative focuses on strengthening risk communication and community engagement to mitigate the spread of infectious diseases. These initiatives represent a comprehensive approach to pandemic preparedness, addressing critical gaps identified during recent outbreaks. The impact of PAHO's investment will be felt across Latin America and the Caribbean, benefiting a diverse range of countries with varying healthcare capacities and vulnerabilities. Central American countries will receive support to strengthen their surveillance systems, laboratory networks, and emergency response mechanisms. Caribbean nations will benefit from investments in climate-resilient health systems, including surveillance for climate-sensitive diseases and vector control programs. South American countries will receive support to expand their laboratory networks, train healthcare workers, and enhance their surveillance and response capacities. By strengthening the weakest links in the chain, the initiative aims to create a more resilient and responsive regional health architecture, capable of effectively addressing future pandemic threats. The COVID-19 pandemic and the 2022 Mpox outbreak exposed critical weaknesses in global health systems, particularly in their ability to rapidly detect, respond to, and control emerging infectious disease threats. In Latin America and the Caribbean, these outbreaks strained healthcare systems, disrupted economies, and exacerbated existing social inequalities. PAHO's investment in pandemic preparedness reflects a commitment to learning from these recent outbreaks and strengthening the region's defenses against future health emergencies. By addressing the gaps exposed by COVID-19 and the Mpox outbreak, the initiative aims to create a more resilient and responsive regional health architecture. The funding will support the development and implementation of evidence-based interventions, such as enhanced surveillance systems and strengthened laboratory capacities. These investments will contribute to a more robust and adaptable health system, better equipped to detect, respond to, and control emerging infectious disease threats. Dr. Jarbas Barbosa, Director of PAHO, emphasized the critical importance of this investment, stating, "The COVID-19 pandemic taught us that we can no longer afford to wait for emergencies to happen. We must invest in preparedness now to ensure our health systems are strong enough to withstand future shocks." PAHO's investment is crucial for building resilient health infrastructure in Latin America and the Caribbean. Sustained commitment and increased investment are essential for the long-term success of these initiatives. The $84.1 million investment by PAHO is a significant step, but it represents only a fraction of the resources needed for pandemic preparedness. Sustainable funding mechanisms are essential for long-term viability and to build a resilient global health architecture. Financial resources must be accessible when needed. This requires a shift to proactive and predictable funding streams. Investing in pandemic preparedness is an investment in global security and economic prosperity. By strengthening global health infrastructure, we can create a safer future for all.